You're listening to IChampionHealth Chats, the podcast dedicated to improving health for all in Lexington, Kentucky. Each episode will connect you with champions in our community who will share powerful stories, expert insights, resources to explore, and ways you can promote health for all. Let's lock in and learn how we can champion health together.
Excuse me, Mr. Gio.
Yeah, what's up?
What does it take to become a champion?
You gotta dream, you gotta think, you gotta act, you gotta ball, you gotta bleed, and most important, you gotta believe.
You gotta dream like a champion, think like a champion, act like a champion, say I'm a champion. Soar like a champion, bleed like a champion, look in the mirror and believe you're a champion. You gotta dream like a champion, think like a champion, act like a champion, say I'm a champion. Soar like a champion, bleed like a champion, look in the mirror and believe.
All right, good morning, all of our listeners and viewers, and welcome to another episode of IChampionHealth Chats. Today, we are located in the Lexington Police Department, located right downtown Lexington, Kentucky. My name is Gibson. I will be your host today, and I am an intervention specialist in violence prevention. Today, joining me is my co-host, Jakob Hester.
Yeah, I'm Jakob Hester. I'm program coordinator for IChampionHealth and a co-producer on the podcast. I'm really excited to get into our conversation today on public safety, particularly violence prevention, and how that connects to community health.
All righty. Thank you for that. And today, our special guest, ladies and gentlemen, we are here with Chief Lawrence Weathers, and he is the Chief of Police of Lexington Police Department. Chief, you have an amazing story to me, of course. I've been knowing you now for the last 10, 11, 12 years.
Something like that, yeah.
Yes, sir. So thank you for being here today and joining our conversation on IChampionHealth podcast.
Thank you for having me. And it's truly an honor to be asked to be here, and I appreciate that. You know, I don't feel like I have that amazing a story just because I've seen so many people go through it.
Yes, sir.
So.
All right.
Yeah, well, starting right there, can you tell us just a little bit about yourself, both personally and professionally?
I was born and raised in Lexington, Kentucky. We grew up in the housing development area. I grew up in the Bluegrass Aspendale area, and then we moved over to Hollow Creek, which is on the north side of town. Coming from a family with 10 kids, a single-parent household. And when growing up in the projects, just about every household was a single-parent household. So that wasn't odd to us. Mother worked 2, if not 3 jobs sometimes, and the older kids had to take care of us. I was kind of on the back end of the one of the last three kids out of that 10. So spent a lot of time with older brothers and sisters. A couple of them went into the service, and our mother. You hear people talk about it all the time. You know, when she was away, we had a little backyard, fenced-in backyard in the housing project area that we lived in. And we weren't allowed to go out of the backyard. And I had an older sister. She enforced that pretty well. And I had 3 older sisters, but one of them worked. And she had 2 kids of her own as well. But you hear all the time comedians talk about having to be home when the street lights came on, and that was true.
Yeah, I remember those days.
Oh, yeah. So went to school. My mother... I don't really call it being strict, but I guess it was strict. But when we looked at it then, it was she wanted her kids to be safe, I guess, and she taught us to be respectful, respect adults, whether they were your parents or people out of your family. It was all adults. Respect them. And you kind of had a neighborhood or a community that looked after all the kids. So when we went to school, our mother made sure And if we brought home a C, that was not acceptable. So we knew that, how that go. I had some of my oldest brothers and sisters participated in sports. And when it came time for college, they got scholarships based on that. I was probably not a sports person. And didn't have the aptitude for that. And I really didn't think about college. But I had to apply. I got, I think, like a small grant, like for $500 to go to college. So I had to get a job and work my way through college. And I remember at one point, just to earn money for my tuition, I worked at McDonald's and I worked at Long John Silver's just to earn money. I would work at McDonald's during the day and Long John Silver's at night. So then the policing job came on. I was at the University of Kentucky waiting for my next class, reading the Kentucky Colonel. So I ended up paper for a police officer. At the time, I had found a job working at a Kentucky Colonel. I'd found a job working at a place called General Tool. And they sold tools. I didn't know anything about tools.
Right.
But in that job, I learned just by listening to people and talking to people and reading. But then I saw another ad in the Kentucky Colonel. I worked there probably, I can't remember, maybe almost 5 years. And I saw another ad for policing in the Kentucky Colonel, and it had health benefits and things like that. And I'm like,
so that tool job was providing tools.
That's right.
Okay.
It definitely was. So I actually went to the owner of the tool store and was talking to him about it. And he said, yeah, you should go ahead and apply. So I did. And, I went and took the test. Didn't know anything about policing other than most of the police drove through our neighborhoods and didn't stop. And that's the only thing I knew about policing. So I got the job and went through the academy, and here I am, 35 years later.
Wow, 35 years.
So yeah, you've had a long time in public service. I know you've had a really long record of different places. You retired once, right?
Right.
You came back, right?
I retired. That's a story in and of itself as well. I retired and took a job as chief of police at or they call it director, but it's chief of police of Fayette County Public Schools. Our school system has their own police department. I wasn't planning on retiring, but the person who was chief then told me that they were going to retire, and I should apply for that job, and I should like it. Just so happens that person was my sister, so she was chief of police prior to me going over to Fayette County Public Schools to be chief of police.
Okay, so it runs in the family then. Okay, a little bit.
a little bit.
Right.
One of my older brothers went into the correction side of public safety, and then my youngest brother, who has since passed away, Kenny, he was in corrections here locally at Fayette County.
Yeah, that's my background too. My mom was assistant director at the jail growing up. So yeah, that's part of the reason I'm on this episode too. I grew up in a household, same thing, like really kind of the entire spectrum of the justice system. I've had somebody in my family work in it. So for you, kind of across that journey, what does it mean to you to have risen all the way to chief of police?
Well, even though we were poor, we didn't dwell on that or anything. And I guess I was probably fortunate because I still remain close to my father. So, it wasn't, my father didn't provide financial support, but he did provide guidance. And that's just as important. Becoming a police officer and rising through the ranks, I couldn't have done it without my family and some of my friends, which I did encourage them to apply for the police department too, and they did. And, Jonathan Washington.
Yes, sir. Good guy.
He abandoned me. He retired before I did. And I can still give him a hard time about that. But he spent 25 years in policing himself. Yeah. So And then several other people that we knew came in. It's just, it's one of those jobs, you hear enough bad things about how police are. And, from my perspective, that's very few. And it's kind of like life. There's good and bad people in life, good and bad people in all professions. The people I met here, and Gio can attest, is the people that you meet here kind of become another family for you.
It does.
I was talking about Gio, and they were talking about his background, and I said, listen, if you can't hold things against people, and there's certain people you meet, and regardless of what kind of past they went through, they're decent people, and you know that. And I told him, I said, I don't meet a whole lot of people that I can trust totally with everything, but I would trust this man with my family's life.
Absolutely.
And you don't come across people like that unless you open up and become accepting. And you can't hold everything against everybody. And that's one thing I've learned being a police officer. And I know it's hard for people to understand it here, but policing gives you that opportunity to get out there and see that you can't just categorize people by groups. You have to get out there and meet people and learn that everybody's different and their capabilities and what they bring to the table is different. And everybody has value.
Thank you for that, Chief. Thank you very much. So we want to address violence prevention and crime prevention and intervention. So how do crime and violence relate to health in our community and the individuals that make it up?
I'll look at it like this, I spent a great deal of time in narcotics, and I talked to a great deal of people about it, and we didn't have the type of drugs that we have today. Today, you got drugs you use one time might kill you.
Yes,
and of course, marijuana, weed, it was there, and I never used that or even thought about using it. And I would always talk to people, and I would say, when they would ask, well, this drug won't kill you, that drug won't kill you, and I go, no, it won't. And when we talk about marijuana, I go, I've never seen marijuana kill somebody, and I guess lung cancer might have taken some people or something like that. I've never seen that. But I have seen people use marijuana and make them do stupid things. And I have seen people killed doing stupid things. So my whole thing is with this, with the community health and violence. When you talk about that, people don't think about domestic violence. People don't think about the substance abuse, including alcohol, that's involved in that. And those kind of things, when you're talking about the health of the community, those kind of things, sometimes people use to self-medicate themselves, especially when they have some mental issues that they don't get diagnosed. And that all leads to access. What communities have access to what? And sometimes we like to think, well, you can always go to the hospital. You can always go to the doctor. Yeah, they'll bill you. You might not be able to pay, but that's life. But how do you get there? Is there transportation there? Sometimes you don't even get treatment unless you can do that copay. Well, the copay is only $10 or $25. So some people don't have that. And they know they don't have that, so they don't seek that. So they seek self-medication, or they get frustrated and they get anger, and that anger builds up, and that leads to violence, and that leads to a lot of the stuff that we see in the community today. So when you're doing outreach, it's simple for people to say, well, let's just make jobs available for everybody. That's not the only issue.
Right.
And it's just like what I was talking about before. You've got to go to every person. And if you're going to help them help themselves, you've got to talk to them and reach out to them and see what their true needs are, because you can't just throw a blanket over that. And when we're talking about jobs, transportation, mental health, conflict resolution, all of those things, if you leave one of those out, that can bubble up. And all those things have to do with the health of the community. Because if you have a person that is restricted from doing something because of one of those things, then they don't grow. And what if they have family? Then their families don't grow. And that ends up being a blight on the whole community, ends up dragging the whole community down. So we have to make sure, even in my profession, that when we go out and we're talking to people, arrest is not the sole focus. It's prevention. It's intervention. And it's reentry has a lot to do with it too. Because some people, if they get out of incarceration, think there's no way they're going to get a leg up, especially when it comes to police. But we have to be on the lookout for that as well, because that keeps us from going to a scene or responding to a call where, because somebody couldn't do or couldn't achieve or got involved in something that they shouldn't gotten involved in, we get called to situations where violence has erupted. And a lot of times for us, that leads to death. And that's very tragic. And it's hard for people and communities to overcome that, especially the stigma, especially if it's associated with a certain area. So we have to be aware of that. And we have to be willing to meet people where they are so they can get the help that they need.
So there's a police officer perspective, and from your perspective as a police officer and being chief of police, how do you see the impact of violence differently as opposed to a citizen or a community member?
Well, and everything I just said, so a community member, sometimes I think they might see, if you get rid of that one offender, then the violence will stop. Mm-hmm. But they don't realize all the things that are interconnected and intertwined with that. So you can't just stop at that. You might be able to take that person out of that situation and remove the violence for a short time. But then when we talk about reentry, you put them back in to a situation that hasn't changed. Yeah. So when you put people out, you got to look, what are the causational factors? And maybe there's some change in there. And so that's where you bring in all your community partners. That's when you bring in all your stakeholders and you start working on the environment. So when that person comes back in, they're not in the same environment that they're in. It's something different. And there should be resources there. Resources to help make sure they succeed on their reentry.
Okay. I know times has changed over the years when it comes to violence and community and whatnot. And growing up in the Aspendale during your time, how do you see what's the change in crime that you see now versus the growing up there and what you're seeing today? How are you looking at that from what scope?
I think people were more connected personally. Okay. I think we miss that so much so that I think we have maybe people today that don't even view other people as human. Mm. And I think, even though my mother worked, even though we were poor, we could not eat dinner in front of the TV. We had to be at the dinner table. And there couldn't be a TV on during the dinner table. So the conversations were with each other. We were connected. When we went out and played in the backyard over the fence, there was another fence that had kids in it. So we talked back and forth over that fence. And the kids, we'd ask permission if they could come into our backyard or we could go into their backyard. People interacted. Our interaction today is social media. I probably had 6 or 8 friends when I was growing up. If you ask young people today, they got, I got thousands of friends.
Mm-hmm. Right.
Where? Social media.
Mm-hmm.
Social media. And those aren't personal connections. And you don't have those personal connections. If somebody says disrespects you on social media, you don't see those people as human. And I think that's what's different today. And I think because of that, any kind of acts of violence has seems to have less of an effect on people that perpetrate it, because they don't have that connection and they don't actually see whoever they're dealing with in a violent manner as maybe human. And that's just my perspective.
Mm.
It's almost becoming normal also over the years.
Oh, well, right. You know,
Sadly.
I remember growing up and they were talking about all the video games that were coming out, and people were outraged and enraged because the games were violent and they were going to lead other kids or young people to be violent. And that got squashed and tamped down, saying, "No, you're crazy. That's not going to do that."
Yeah.
But now you look at it and you look at some of the video games that are out there now, you know, and not only are those video games out there, you used to have to buy a cartridge and plug it into the machine. Now you don't. You can get on the internet and literally worldwide reach out, and you can play live with people you don't even know and don't even know their backgrounds. And that's just, I mean, that's kind of scary.
Mm.
And the type of violence that's seen in some of these video games, that kind of normalizes it, I think. And I'm not blaming it all on video games, because guess what? Parents still need to be there.
Yeah.
People still need
Definitely.
to be there to interact. And I don't think we have that. I think we just shove some of our young people in front of it, of the video games, and let them go. And that's what we're exposing our people to. And when they see that, it's kind of like, well, that's normal.
Okay. So in switching it to a health topic, what do you think the community needs right now when it comes to health in our communities?
Oh. Because not just in video games, but even media, news, and everything, the type of violence that we see, the type of events that we see taking place, active shooters and all that kind of stuff, what we prepare our young people for today, you know, I think we need a lot of counseling, a lot of people to interpret, help not just young people, but help adults interpret what's happening and give them more alternatives on how to deal with that. You know, I look at my officers and see what they deal with. And to me, it's important that they have access to good mental health care. And I think the community as a whole needs to start focusing on that before. I mean, it needs to start when they're young. I'm talking about elementary age, middle school, high school. You get some of it, I guess, a lot with some of the colleges, but it kind of needs to be routine, and there shouldn't be a stigma associated with it at all, because they do see a lot of trauma today. You have friends getting shot, and whether you don't see it in person, somebody's there with a camera to video it, and you see that. And just access to good mental health care, I think, would go a long way to helping communities overcome some of the violence that we see.
Okay. How does a community, individually or collectively, assist with crime and violence prevention? We know everybody's not a big fan of law enforcement and police officers, and you know, we've seen a lot of things over the course of the years and decades of, you know, that gap between law enforcement and community. How can we bridge those gaps, and how can community assist with when it comes to these issues that we're dealing with? You know,
I talk to my officers about that gap, and when we talk about the thin blue line, I tell them, you know, that's not a wall. It's not the thin blue wall. It's a thin blue line. And if you think about a line, it's not a bump or a hill or some kind of obstacle, it's smooth and straight so that anybody on any side can come over onto that line and can come over. And the police officer's job is to make sure that line is accessible. And we should be reaching out and telling people, come on over here, we can help. But we don't, you know. Sometimes we kind of, and it's odd, we're there for the people, but sometimes some police just kind of wrap into themselves. But we are part of the community, and we have to connect. And if communities are going to overcome the violence or be more efficient in addressing it, it goes back to what I was talking about before, connectivity. Mm-hmm. We've got to go out and talk to each other. We've got to go out and meet each other. We can't just hit a button and click and say, yeah, I like this. No, I don't like this. You know, we have to be willing to agree to disagree, and we have to be willing to compromise. It seems like in today's society, it's an either or, and you can look at it, some of the things that go on today. People are always demanding, and then they don't want to accept any kind of compromise. They want their demands met. But your demands might infringe on somebody else. And what are you going to do about that? You know, there's going to have to be compromise somewhere. And if we don't learn to connect, if we don't get together and work on the issues that are causing us harm, we're not going to succeed. The old saying, it takes a village to raise a child, well, that's been skewed to kind of mean that, or kind of people see it as, well, the village has to raise the child. Well, what are the parents doing?
Right.
Well, and that's not the way I look at it. I look at it, when it says it takes a village to raise, the village sets the standard that the parents raise the child to. And if the parent is not raising the child to the standards except to the village, then the village needs to come forward and connect with that parent. Say, look, this is how we want things. This is how things need to be done. And when we do that and everybody's on the same page and everybody values the same things, especially life, then violence will take care of itself.
Okay. You know, Chief, again, you know, I know you're a very humble man. We appreciate you. I wanted to ask, what advice can you give the community, especially of our young viewers? Now, you rose up through the ranks. You know, you started at some odd jobs as a kid growing up. You did have structure, so you did have family support. You grew up with, it was 10 of you, sibling-wise, and your pathway to your career was not easy. What advice can you give the community and our young viewers on, you know, when you're choosing a career or when things get rough, or I mean, how did you push through all of this?
My brother played professional basketball, and he was really, really good. But he realized one thing: everybody can't be number one. And I think we strive to be number one, and if we don't make it, we look at that as a failure. To be successful, you have to get in your own mind what success means. For me, success meant being able to take care of my family, not being able to give them everything, but just making sure that I was there for them and the bills got paid, and that at least they would have food. Understand that success is not how much money you make, how much property you own. Success is really how successful are the people that you take care of. That's what I look at success as. Are they decent human beings? Yeah. Are they going to do what's right? Yeah. It doesn't matter if they make money, if they go to college, are they going to be productive, contributing members to society? That's what success is. If you're going to do any job, learn, continue to learn, keep learning in this job. I'm constantly learning. I don't like to read, but I read because that's how you learn. One of the most important things, one of my mentors taught me, is that you can't just read the stuff you like. You have to read the stuff you don't like. You have to read the stuff that's contradictory to what you believe. Yes, otherwise, you don't know what you're talking about. I didn't do anything special to be here. I just thought it was important that if you do a job, you put your all into it, and you make sure other people put their all into it. And that's not as hard as you think, because if people see you doing your best, they'll do their best as well. And I don't, any success I have is not because of me. It's because of the people that help me do what I do. That's what success is. Everybody helping each other do what needs to be done.
Amazing.
Well, thank you so much for your time. You've been really generous. I know you have a hard stop here in a second. We got one last question for you. We ask each guest, the name of the podcast is IChampionHealth. So we ask each guest to fill in the blank. IChampionHealth through?
I champion health through connecting with other people and meeting with other people and seeing what their needs are. And in my position, I know a lot of people and I have access to a lot of resources. And if I can meet people and help people get connected to the resources they need, I think that's the best way to champion health for me.
Wonderful. Thank you so much.
All righty.
Thank you.
So again, to all our viewers and listeners, we just want to thank you again for tuning in to another episode of IChampionHealth Chats. Don't forget to follow us on social media. Again, we want to thank Chief Lawrence Weathers for being our special guest today, my co-host, Jakob Hester. And again, be on the lookout for more podcasts in the future. And remember, change starts with self, and let's keep the peace.
Thank you for tuning in to IChampionHealth Chats. If you enjoyed this episode, please be sure to hit the follow button in your favorite podcast app and share with your community. You can connect with us by searching at IChampionHealth on social media or by emailing ichampionhealth@uky.edu. IChampionHealth is a collaboration between the University of Kentucky Prevent Alliance, Operation Making a Change, and the United Way of the Bluegrass. The IChampionHealth team encourages you to get vaccinated for COVID-19 and stay up to date with boosters. Vaccines are a safe and effective way to protect yourself and your community. This podcast was supported by funds made available by the Kentucky Department for Public Health's Office of Health Equity from the Centers for Disease Control and Prevention, National Center for STLT, Public Health Infrastructure and Workforce, under RFA OT 21-2103. The contents of the podcast are those of the authors and do not necessarily represent the official position of or endorsement by the Kentucky Department for Public Health or the Centers for Disease Control and Prevention.